After your surgery, you will be transferred to the recovery room or the post-anesthesia care unit. You should expect to spend about an hour's worth of time there, give or take a little bit. And the whole point of the recovery room is to recover you. Your nurse there is going to be watching your vital signs, your oxygenation. This is where they're really going to start looking at pain and nausea and trying to get you good and awake. They will keep you in the recovery room until you're stable enough to go out to the 6th floor. And when you are ready, the recovery room nurse will call your loved one and let them know that it's time to move you to the 6th floor and what room that you are going to be going to. Okay, once you're stable and you're ready to come on up to the 6th floor, the recovery room transporters will bring you on upstairs and we will get you settled into your room. All of our rooms are private rooms. And so that's nice to know. And they're pretty roomy. You do have a lot of equipment you'll probably need to use as you're recovering with us. So we like to give you plenty of space to move about. Few things I like to point out. We do have a call bell system, of course, at our handheld sets. You can call out for the nurse, you can control your lights, you can control your television with that. We also carry SpectraLink phones, the nurses and the assistants do. And there is a whiteboard in your room that we can write your nurse's name, your assistant's name, their phone numbers on. In addition, we can write down your physician's name, your discharge planner's name, what kind of diet you're on, what kind of mobility restrictions you might have. And there's also a place on there where we can help you keep track of your pain medication, and I'll get to that in a little bit. A piece of equipment we will bring you once you get to the 6th floor is called an incentive spirometer. When you undergo anesthesia, it puts your whole body to sleep, including your lungs, and your lungs deflate just a little bit. In order to prevent any respiratory infection, pneumonia, or bronchitis, we're going to teach you how to use this incentive spirometer, and we're going to ask you to use it about 10 times every hour while you're awake. So it's not something you have to set your alarm to if you're fast asleep, because we do want you to rest too. I always tell folks, if you're watching television, do a couple repetitions during a commercial break and you should have your hour covered. It is important that you inhale with an incentive spirometer to inflate your lungs, because that's the whole purpose. A lot of people want to blow into this apparatus and that won't do anything to help you. But we will instruct you how to properly use this once you get to the 6th floor.